Question 1. What is the primary reason we focus only on public events in applied behavior analysis and not public and private events? When we think about public events, we think about things we can see, things we can observe, outward events. When we think private events, we think internal, things that happen inside of us that we can't see, that we can't observe as a third party. Now, the confusion becomes, do private events affect behavior? Are private events behavior? The answer is yes. Thoughts, for example, are behavior. Now, why don't we work on those? Why don't we focus on those specifically in behavior analysis? What's the reason? If we know thoughts are behavior, if we know thoughts control what we do, why shouldn't we be focusing on thoughts as much as things that we can actually see, these public behaviors? A, private events do not have any effect on behavior. Well, we just went through that, and we know that's incorrect. Private events certainly have effects on behavior. Emotions, thoughts, feelings, all these things that we can't see, that we can't measure, still have an impact on behavior. We're not saying they don't. But when we're designing treatments, when we're designing interventions, we need to focus on things we can change, okay? And things we can change are things we can measure and things we can observe. So if we look at B, private events are not measurable, this is a primary reason we only focus on public events. We can't measure thoughts. We can't observe thoughts. How can we consistently change them? How can we consistently intervene on things we can't see or measure? That's the main problem with private events. And it's the reason we focus on public events. B looks like our best answer. Are we just going to pick B and move on? No. We're going to read all of our answer choices and understand why the other ones are wrong. C, private events are not part of behaviorism. Not true. When were private events introduced? During radical behaviorism. Remember, we have methodological behaviorism, and then we had radical behaviorism, which acknowledged private events as behavior, right? So C, yes, private events are part of behaviorism. We're just not going to use them because we can't measure them. And then D, public events always influence behavior more than private events. Not necessarily true. You can't say that definitively, okay? We just can't see them. We can't measure them. It's going to be better to focus on public events. So why do we focus? Because of B, private events are not measurable. Jim is sitting at his desk across from Dwight. Jim rings a small bell and then offers Dwight an Altoid, which causes Dwight's mouth to dry up. Jim does this every day for 2 weeks. Now, when Jim rings the bell, Dwight's mouth dries up. What is the conditioned stimulus in this example? What type of conditioning are we talking about here? Are we talking about operant or respondent? Since we're talking about a reflex, this mouth drying up, we are talking about respondent conditioning. I've always remembered respondent conditioning from the scene in the office when Jim offers Dwight the Altoid and he conditions him every time that sound goes off on his computer to start to salivate and his mouth dries up. So if you haven't seen that scene, maybe you can look it up on YouTube. I think it's a good memory jogger. But regardless, we're going to use the information in this question to answer the same thing, right? We're looking for the conditioned stimulus in this example. Remember, with respondent conditioning, we have our unconditioned stimulus and our unconditioned response, or unconditioned reflex, I should say. We then pair a neutral stimulus with the unconditioned stimulus to create a conditioned reflex, right? So let's break it down. What is our unconditioned stimulus? The unconditioned stimulus is going to be the Altoid. The Altoid is going to make Dwight salivate. It's going to cause his mouth to get all dry. What is the unconditioned reflex? It is the mouth drying up. So what is the neutral stimulus? The neutral stimulus is going to be the small bell originally, right? But once we pair that small bell with the Altoid, what does that small bell become? Now, when Jim rings that bell, Dwight's mouth dries up. That bell is now eliciting that reflex. That bell becomes a conditioned stimulus. So if we look at A, what is the conditioned stimulus? It's the small bell. The Altoid is what? The Altoid is the unconditioned stimulus. sitting at the desk is irrelevant for our respondent conditioning. And then Dwight's mouth drying up is either going to be the unconditioned reflex or the conditioned reflex, depending on how you look at it. But the small bell will be the conditioned stimulus. Just remember, right? Respondent elicits a reflex. We take an unconditioned stimulus, an unconditioned reflex. We pair that unconditioned stimulus with the neutral stimulus, and then we create a conditioned stimulus. Your significant other wakes up earlier than you for work during the week. However, when they wake up, they always make too much noise and wake you up as well. If you wanted to implement a differential reinforcement procedure targeting the noise-making behavior, what differential reinforcement procedure would be best? On the surface, this looks like a very straightforward DR question. But we're taking the BCBA exam now. We want to go a little deeper. Think about what's happening in this scenario. Your significant other is waking you up every morning. You want a different behavior to take the place of that behavior. Clearly, you want a replacement behavior. But what's going to be the best way to, let's say, prevent that noise, right? Because it's clearly bothering you. Well, what about a DRO? Does a DRO teach a replacement? No. A DRO just offers reinforcement for when they don't make noise. All right. So, yes, maybe this might reduce the noise making. Okay. But are you teaching a replacement behavior? No. And typically, when you take away one behavior, we're going to want to teach another behavior, right? DROs typically for high rate, dangerous behaviors that we just need to get rid of immediately. In this case, you really want to try to teach a replacement behavior. So what about a DRA? Is a DRA going to teach a replacement behavior? Absolutely, right? A DRA is going to teach an alternate behavior. But what's the problem here? Well, with an alternate behavior, the noise making can still occur. That's the definition of differential reinforcement of alternative behavior. The old behavior and the new behavior can occur simultaneously. So if we look at a DRI, now we're going to teach an incompatible replacement behavior where these two behaviors can't occur at the same time. Meaning not only does she not have to make noise, but she also has to engage in this new behavior to receive reinforcement. So in this case, DRI is going to be the strongest. Not only are we reducing the noise making, but we're increasing an incompatible behavior with the noise making. DRH, of course, is going to increase it, which we don't want. So what is going to be the best procedure here? It's going to be a DRI. You have to think a little deeper on that one. You have to just can't stop at DRO and say, well, we're reinforcing, right, in the absence of the noise making. Can you do better? You always need to figure that out. Do we have a better answer? Is there going to be a better answer on the exam? The most common thing, the most common bit of feedback I get, I should say, is every question felt like there were two right answers. That's just the exam, okay? You need to get really good at identifying the best answer out of the two good answers. JD is a doctor at Sacred Heart Hospital. This is his first year, and a supervisor, Dr. Cox, asks him how he thinks he is doing compared to his peers. JD isn't quite sure how to respond. Dr. Cox is asking JD to engage in what? Now, if we just read this question, the question stem, a bunch of things might come to our mind, right? It's kind of an ambiguous question. So while we want to attack the question, sometimes the answer choices can guide us. And if we look at the answer choices, this is clearly, right, a self-control question, quote unquote, right? A self-management question. Remember, self-control is a misnomer. It's still the environment. When we talk about self-control, we're really talking about self-management, okay? So with self-management, we have some of these steps. We have self-monitoring, self-instruction, self-evaluation. Dr. Cox wants JD to engage in one of these. And which one is he going to engage in? A, self-monitoring. With self-monitoring, we are literally watching ourselves complete a response, do a task, and monitoring how we're doing. Okay, we're recording it, and we're just taking some data, basically. Is that what JD is doing? No, JD is comparing himself against peers and telling Dr. Cox how he thinks he's doing. So does that sound like self-instruction? Self-instruction is essentially self-talk, walking ourselves through a task. Again, JD's not doing that. JD is self-evaluating. He's evaluating his own behavior compared to his peers. It's a clear self-evaluation. The most important thing about self-management is understanding that self-management is changing a desired behavior, basically seeing a change in your desired behavior. Okay. These different components all make up that core self-management philosophy. Also, self-control, once again, misnomer. Self-control doesn't really exist because the environment is what's controlling our behavior. Recently, John has started to take cookies from the cookie jar before dinner. John's father reacts by introducing a punishment procedure where John will lose access to all electronics for the rest of the night. John is now engaging in significant aggression where previously John was not aggressive. What might explain John's aggression? If you've been studying my study guide, or if you've been studying in general, one thing should immediately come to mind. All the hints are there. All the breadcrumbs are there. This is not too difficult of a question. We have a boy. His father introduces punishment. All of a sudden, the boy spikes in aggression where he was never aggressive before. What are you thinking of? A, John's dad accidentally reinforced the cookie-taking behavior. Does the aggression have anything to do with the cookie-taking behavior? No, right? He was never aggressive before. He was just taking cookies. The aggression has nothing to do with increasing cookie-taking behavior, right? B, John is experiencing punishment-induced aggression. Yes, this is a thing. Punishment can lead to aggression. There can be resistance to punishment. This is just one of our many ethical concerns when we use punishment. People fight back. When you feel punished and you feel like you can go against that punishment, aggression comes out. There's resistance. This appears to be some sort of punishment-induced aggression. Do we have a better answer? Maybe. C, John is going through an extinction burst. Are we using extinction? No. Be very careful. A lot of people just like to put extinction burst whenever behavior spikes or behavior increases. You have to be using an extinction procedure to consider something an extinction burst. We're using a punishment procedure. Extinction is not punishment. And then D, John's dad did not implement punishment correctly. There's really no indication that's the case. He might have implemented it too well, right? Causing John, who's now no longer getting these cookies and who's being punished from these cookies, okay, to lash out. So we're not really sure how well or not well he implemented punishment. All we know is once punishment started, John started engaging in aggression where before there was none. So what might explain John's aggression? Parsimony. John is experiencing punishment-induced aggression. William meets with Monica every other week to discuss cases and interventions. Monica is pursuing her BCBA certification under William's supervision. William makes sure he observes Monica, provides her feedback, and reinforces Monica when she does something right. What else should William do? Appears to be a pretty good supervision team. William is being a great supervisor. He's directly observing her, which you should do. Even if you're doing remote supervision, you need some sort of direct observation. It's a requirement. He's giving her feedback, and he's reinforcing her when she does something right. What else can he be doing? What else should William be prioritizing? A, implement a punishment procedure to decrease Monica's inappropriate behaviors. Is there any indication that punishment is needed? Not necessarily. He's got a reinforcement system going. Should is our key word. Should William implement a punishment procedure? Not necessarily, right? Will he? Maybe. But should? No, right? B, meet with Monica more frequently. Well, he meets with her every other week, which seems enough to satisfy the supervision requirements, depending on how long, et cetera, et cetera. Really no indication. Could he? Maybe. But again, every word on the exam could be important, especially when it's involved in the question you're answering, I should say. So what else should William do? Should is very strong. Should he meet with Monica more frequently? Maybe, maybe not. Should he implement a punishment procedure? Maybe, maybe not. We could go either way. Neither are a should. Okay. C, solicit feedback from Monica on how supervision is going. Yes, this is a requirement. If you want to be a good supervisor, it is required that you solicit feedback from your supervisees. So after all is said and done, William needs to go to Monica and ask her straight up, how is my supervision? This is something he should do. And then D, ask the stakeholders of Monica's cases how she is doing. Maybe, maybe not. It's a little invasive, a little intrusive, just depends on their relationship. The only thing William should do is C, solicit feedback from Monica on how supervision is going. Again, this is why it's so important you read the questions carefully, you identify all the keywords, and you answer the question specifically and to the best of your ability. Which of the following answer choices is the best example of possible confounding variables? To answer this, you first need to know what a confounding variable is. Well, it has to do with research. And in research projects and experimental design, we're trying to establish some sort of functional control, meaning our IV has control over the DV, our independent variable has control over the dependent variable. What we're doing, what we're manipulating, what we're changing is what's controlling the behavior, not anything else. A confounding variable is something outside of our control that is affecting the intervention or the outcome. We want to control for these things as much as possible, but typically with confounds, you don't even know they exist until maybe it's too late, okay? The question asks, what is the best example of possible confounding variables? So based on what we just talked about, what kind of answer choice are we looking for? This is what you should be asking yourself. What am I looking for? Let me predict the answer. We're looking for a variable that we don't control, but that can possibly have control over the outcome. That's what we're looking for. So A, to help control itching behavior, John wraps his son's arm with a bandage. Are there any confounds? Is there anything out of John's control, okay, given this information, that will affect controlling itching behavior? As far as we know, no. John's intervention is wrapping son's arm with a bandage, and he'll see how the itching behavior goes. Doesn't appear to be any confounds, okay? B, Greg implements an intervention targeting math for his tutoring student. At the same time, the tutoring student starts a computerized math program at home. Are there confounds? Is there something out of Greg's control? Yes. This computerized math program, Greg has nothing to do with. Okay, he might not even know about it. So while he's intervening on math for his tutoring student, maybe at his house or clinic, at the same time, this tutoring student is getting extra help at home. If this tutoring student starts to improve, Greg might look at his data and say, wow, my intervention is really working, when in fact, it was the computerized math program. That is the confound. B is a good example of a confound. So far, our best answer. C, first, Jay implements a DRO procedure to reduce screaming. Then he attempts a DRI procedure. Now we have multiple variables here, but in every case, Jay has control, we assume, over the variables. So either one might have control over the outcome of the behavior, but Jay is controlling those variables. If you can control the variables, they're not confounds, okay? D, mom and dad agree to no longer give attention when their 2-year-old bangs on the door at night. Again, looks like extinction, only variable involved in the intervention, nothing else going on that we know of. We're only using the information given. So given what we know, given our answer choices, B is by far our best example of a possible confound. The computerized math program might interfere with this intervention that Greg is using for his tutoring student. Another way to describe a change in the height of data points is a change in what? Easy question, easy graphing question. We have level, we have variability, we have trend. This is pretty much the first thing you learn about graphing in ABA. What is trend? Trend is the direction the data points are moving. If they're moving up, we're increasing. They're moving down, we're decreasing. Variability is basically the distance from the highest data point to the lowest data point. How much is the data jumping around from point to point? How much is the data changing each time you measure it? That's your variability. When we talk about height, we're talking about level, okay? So if we have a data path that's down here at 2, and then when we change phases and it jumps up to 6, the height of that data has changed. So has the level. So another way to describe a change in height of data points is level. Pretty straightforward question. Very easy. If you don't know that, go back, review basic line graphing, basic graphing. If you wanted to conduct a CoOp training, which of the following would be the best way to go about doing it? What's our rule for verbal behavior on the exam? We need to know what evokes the verbal operant and what reinforces the verbal operant. You also should be familiar with formal similarity and point-to-point correspondence, but the first two are very important because those will guide training. If we're conducting a CoOp training, what do we need to be concerned with? We need to be concerned with what evokes echoes. What evokes an echo is a verbal SD. Okay. What reinforces an echo is typically a generalized condition reinforcer. And we know in a CoOp is going to be formally similar and have point-to-point correspondence. So we're looking for all those things in our training. That's going to guide our answers. So A, show your client flashcards with words written on the cards. Reinforce when the client reads the word. Is this an echoic? Is this evoked by a verbal SD? No, your client is reading. This is a textual. This is textual training. B, reinforce your client when they respond good when someone asks them, how are you? All right, verbal SD, but do we have point-to-point correspondence and formal similarity? We have similarity, but not point-to-point correspondence. They're not the same. Good and how are you are different. B is out. C, reinforce your client when you see a tiger and say tiger, and your client says tiger. Okay, verbal SD. Okay, client copies you, point-to-point and formal similarity. Closest thing so far to an echo. C is our best answer so far, excuse me. And then D, when your client says iPad, give them an iPad. Clearly a man right there. C is going to be our best answer for a CoOp training. Reinforce your client when you see a tiger. They say tiger, and your client says tiger.